Tonight, state lawmakers are debating a bill that could reshape how the state handles doctors in distress.
Yeah, some call it a necessary lifeline. Others say it risks patient safety. ABC 10's Paul Sanga explains why the fight hits close to home for some.
AB 408 by
Assembly Bill 408 is not just about health care. It's about trust.
Let's help them get that help that they need before they harm patients.
The bill would allow doctors to seek confidential help for substance use or mental health issues before putting patients at risk. Backed by the California Medical Association and the Medical Board, the bill's author, Assemblymember Marc Berman, says the bill revives a former support program, this time expanding it to include medical residents.
Patients and physicians deserve a program that will help physicians before they become a problem.
There would be no public record or discipline unless a patient is harmed.
Or if a medical professional has sexual misconduct with a patient, this program does not apply to them.
But critics say they have seen this before. A similar program was shut down back in 2008 after oversight failures caused harm.
And I'm okay with doctors getting help, but do not practice while you're trying to get help, because it doesn't work.
Tina Manassian still carries the scars from a 2002 botched surgery by a doctor she later learned has been secretly enrolled in that program.
He was in diversion twice, and he failed twice, and they still didn't take his license.
Consumer advocates fear AB 408 lacks accountability and believe history will repeat itself.
Doctors were avoiding drug tests. They were being tipped on it off in advance when those tests would be taken. Failed tests never got reported back to the board.
Supporters argue this version adds guardrails, strict eligibility, expert treatment, and early intervention.
But since then, we've learned a lot about substance use disorder.
Opponents, like Consumer Watchdog, argue patients deserve more than lessons learned. They deserve transparency.
If your surgeon is in treatment and relapses, wouldn't you want to know about that relapse? I think there's only one answer to that question.
Reporting from the state capitol, Paul Sanga, ABC 10.
The bill passed the Assembly last month and is now in Senate hearings. It must pass the Senate and be signed by the governor to become law.